sometimes with weighted cones, and they gradually increase the cones to increase your strength. It's kind of like a Kegel exercise, but it's under very specific guidance. We have a great physical therapist here, Christine Fitzgerald. So anyway, surgical management is also a very good way and curative way once all the conservative methods have been tried and failed. And the urologist, Dr. Barnes, is going to talk more in detail about that. So detrusor instability, or this bladder muscle weakness, the loss of the urine caused by this uninhibited or uncontrollable contractions of the bladder muscle, usually becomes a sudden, unexpected, large loss of urine. Like I said, you just all of a sudden feel like the urge. You didn't have any urge before, and you're walking in the mall and you can't get to the bathroom and you lose a lot of urine. Another, which I see more in younger women, is a small amount of leakage with a very strong urge. But at this point, their urethra is strong enough to actually voluntarily contract and not allow them to lose the urine, but it's a similar process of what has gone on. Sometimes detrusor instability or this bladder instability is caused by neurologic diseases, again, strokes or MS, Parkinson's also often can cause this. And it's diagnosed usually by urodynamics. Treatments for this, again, mainly actually for detrusor instability are medications. And unfortunately, there are a lot of side effects to the medications, and so patients often stop their medications. The side effects include dry mouth, palpitations, constipation, and blurry vision. Behavioral modification is probably one of the better ways to get someone to try to comply to and improve their detrusor instability, and that's actually sort of retraining your bladder. You know, when you're training your child to go to the bathroom, you want to ask them every hour, do you have to go to the bathroom? You want to go to the potty? You want to go to the potty? And sort of you kind of do that to yourself by making yourself go to the bathroom every hour. Whether you feel like you have to go or whether you don't, you actually do a time. If you have to go to the bathroom 45 minutes into your hour, we try to have you not go. In other words, really try to hold it for that hour. Once you've done that for a period of time and you're able to do that, increase by very, very small increments. And it's actually very successful when followed. Mixed incontinence is a difficult problem to solve. As a physician, what we really have to find out is we try to find out, differentiate which of the problems is the main reason that the patient has come to the doctor. We try to cure that one, hoping that the other one will either be minimal or, again, curable if it's not minimal. One major thing for you to also remember is that most, or a lot of the times, urinary incontinence is curable and reversible. And there's a mnemonic, diapers, which is appropriate for us to remember what causes of incontinence are actually reversible. And delirium, someone who's not really with it can obviously have incontinence, and we can usually find a cause for the delirium and hopefully reverse that. Infection, easily treated. Atrophic urethritis or vaginitis, which, again, as a gynecologist, we like to use Premarin, or estrogen cream, I should say. Pharmacology or medicines, we talked about a lot of medicines that can cause urinary incontinence, and we can change those medicines. A lot of hypertensive medications cause urinary incontinence, and there are other choices that we can discuss with the primary physician who's put you on that. Psychological causes, excessive production, restricted mobility. In other words, someone who can't, in a wheelchair, for instance, can't just go to the bathroom anytime they want, and so their bladder gets full and they actually have incontinence, and stool impaction or any kind of impaction or prolapse. Prolapse is actually a big thing that I see all the time as a gynecologist, and that's downward displacement of a pelvic organ from its normal position. And that can be the uterus, the cervix, the bladder, the rectum, actually. There are a lot of organs within the pelvis that can actually lose its muscular and collagen vascular fibers and actually come down. And people sometimes leave that for many, many years because it's really not a health hazard, but it then gets worse and worse and worse, and again cause, number one, incontinence, and number two, actually retention, because if it's so severe, it actually kinks the urethra.